Hi, good morning, everyone, and thanks for the warm welcome. And I'm very happy to see so many happy faces, cheerful faces around. Okay, without much ado, we will just dwell into this topic. So, is the blood pressure trying to tell you something? So, um, for this talk, I'm going to just, this is going to be the brief overview of the talk. So let's understand some basic terms as to what a blood pressure means and how is high blood pressure diagnosed and what are some of the factors which can actually affect the blood pressure. Then we look a bit into what are the cutoffs which doctors use and how we are going to treat it. And at the end of the talk, I will just focus a bit on a few common myths which people generally have and what are the scientific explanations behind it. Okay, now we all would have heard about this term pressure when we are schooling, right? So, pressure is something which is inherent, and we know that a column of fluid will exert a pressure. And the diagram, what you see to the, sorry, I see whether my pointer works. Don't, okay. Okay, the diagram, what you see to the left of the image, I have depicted two, fluid columns. So one of the column of the water, you see that the level is lower, the other is higher. So the higher the column is, so by the principle of physics, the pressure exerted will be much higher. Now, this is the same concept which happens in our body. So our heart, we know that our blood is fluid, so it also will exert some pressure within the blood vessels. So if you imagine our blood vessels to be cylinders, it is going to exert some pressure along the sides, along the walls of the blood vessels. And this is what we call as a blood pressure. So blood pressure, everyone has. So some of them may wonder, do I have blood pressure? Yeah, everyone has blood pressure, and blood pressure is needed because it is this force which helps you to make the blood reach different parts of the body, all the nutrients to be delivered, oxygen to be delivered. But high blood pressure is something which we don't want to have. We want to have this blood pressure in the nominal range so that it helps us to it helps for the body to receive the oxygen and nutrients, but not too high so that it doesn't cause damage. Now, what are the factors in our body which determine this blood pressure? So if you see, there are two main integral things which we are talking about here. One is the heart. Our heart is the central pumping organ. So it's again is similar to, if you think about concept in daily life, you have a motor, you have a pipeline, then the water comes out. So it's exactly similar like that. You have a heart, which is the motor, which tends to pump and squeeze the blood out, so it generates a pressure. The second factor here, what we call as a systemic vascular resistance. So what this means is, you see the blood being pumped out of the heart, it goes through the arteries, it has to pass through what we say a capillary bed, and this is where most of the oxygen and the nutrients is taken up by the tissues. Now this constitutes some form of resistance, and which we call as a systemic vascular resistance. If let's say I increase this systemic vascular resistance, then the heart has to pump against more increased force. Of course, the blood pressure is going to go up. So both these factors are often regulated well enough in the day-to-day life such that blood pressure is easily regulated. Now, how do we record this blood pressure? So we have what we call non-invasive measures, which is to your left, and we have the invasive measures here to the right. So invasive are generally used in the hospitals when people are very sick, they're admitted to intensive care where we need a continuous monitoring. We do have cannulas which are put into the artery. So there is a transducer which will directly keep recording the blood pressure continuously. The non-invasive measures are the most commonly used ones. You would have I think you would have seen some station with the blood pressure monitoring set outside. So this is how non-invasive measures are done. So we just tie a cuff and then it just records the blood pressure. There are several variations of this. So the one image to the right there you see is the older conventional mercury sphygmomanometers. So of late we are using digital devices which are quite well validated. So we have the arm as well as a wrist device. So generally the arm devices are more accurate than the wrist, and we also have a 24-hour ambulatory blood pressure device. So these are some devices to record the blood pressure. And we know that it is generally measured in two readings. The top reading we call as systolic blood pressure, the bottom is the diastolic blood pressure. Now, what are some prerequisites before you actually record the blood pressure? So before recording, ensure that you are well rested and you do not immediately, just prior to the recording, you don't take any caffeinated drinks or no smoking. And it's better to empty the bladder, because if you record on a full bladder, the readings may be higher. Now, when you're recording itself, it's important that you're well rested, your arm to be at the same level as your heart. So not higher, not too lower, because that may also affect the readings due to the gravity. And cuff has to be applied against the bare skin, and your back should be supported. Then avoid any talking during the recording, and it's better you just sit with the feet flat on the floor. So this is the conventional position we record the blood pressure. Now, one other thing is, after you have finished recording, so you have to, if let's say the reading is elevated, you may want to wait for a few minutes, repeat the reading, recheck again, and often keep a log or keep a record of the readings which you have taken. And above all, stay calm. This is what I will enforce, because the moment you see an elevated reading, you panic, the subsequent readings are going to be very high. So especially if this is just a random recording which you are taking and it's elevated, don't worry, just stay calm, repeat the readings. If it's still high, just seek advice from your doctor. Now, what are some of the common errors which can happen when you're recording the blood pressure? So number one, yes, if you're anxious, the reading is going to be higher. It's better you avoid, relax, and then recheck again. If immediately after an exercise or coffee, yes, the readings may be higher, and or you improperly position your hand, or you choose an improper cuff size. Now, what do you mean by this cuff size? So normally, this blood pressure set, there is a bladder inside and there is a cuff outside. Now, this encircles your artery, and that's how the recording of the blood pressure is done. So there are many sizes, but standard conventional size will be the one in the center, which normally the blood pressure sets will carry. But there are smaller size cuff and larger size cuff. So the importance is that this cuff should encircle at least 80% of your arm circumference, and the width of the cuff should be at least like about 40% of your length of the arm. This is a rough gauge which we use. If you use a smaller size cuff, meaning the person is very obese, smaller size cuff, the readings tend to be very high. If you use a larger size cuff in a very small individual, the readings may erroneously be lower. Now, this is some concepts to be kept in mind. So average, you have to choose depending on the size. If the person is too big, you may use a larger cuff, or too small, you use a smaller cuff. And last but not the least, if you are worried that your readings are very discordant, it can sometimes be due to faulty device, just recheck with another machine or recheck in the healthcare facility. Now, what are the variations in the blood pressure? So, number one, if you record your blood pressure in your legs, it may be higher than in the arms. So this is a normal variation. This is due to effect of gravity and the leg arteries compliance. So this is a normal variation. So some people may find, my leg blood pressure is 10 millimeter of mercury higher than the hand, which is normal, acceptable. If it is beyond 10 to 20 millimeter of mercury, then it is considered to be abnormal. Now, the second thing is, yes, in children, the readings are lower compared to adults. And what about seasons? So during the winter season, sometimes the readings tend to be higher compared to the other seasons. Is because During winter season, sometimes your vessels can have some form of vasoconstriction, we say. So it tends to increase your vascular resistance and the blood pressure can go up slightly. But these defects are not very marked. It can be very minimal or marginal. And during sleep, the readings are lesser. What about when you see doctors? Yes, your readings can go up. You are anxious. And if you're worried, depressed, your readings will be higher. And after an exercise, your readings are going to be higher. And after a drink, coffee, matcha, tea, all this, the readings may be higher. Yeah. And after a heavy meal. Okay, so these are important physiological variations you have to keep in mind. Okay, now this is a typical pattern how the blood pressure fluctuates during the day. So some people will say, oh, my reading just is very different every time I take. Yeah, it is supposed to be different. It cannot be a fixed reading because our body responds to physiological needs. Let's say you start from the left side and let's move on to the right. You see, when waking up, the reading is about 110, like that. Then going to work, having an argument, you see how the reading can go up. Then going back, and finally at sleep, it goes down again. So these are some of the typical fluctuations you see. And that's why when we look at the blood pressure readings, we have to take it into account that the person is relaxed. And that is what is the actual blood pressure. Okay, now we have seen a lot about this blood pressure and these variations. So what hypertension means? Hypertension means elevated blood pressure. The blood pressure which is beyond the acceptable physiological limits. That's what I would say, because there are some physiological limits which we have seen, some physiological variations we have seen. And this reading has to be confirmed on a minimum of 2 separate occasions, at least 1 to 4 weeks apart. And that's when we diagnose high blood pressure or hypertension. If, let's say, you see us for the first time, your reading is elevated, we will say, okay, maybe, yeah, but let's repeat it. Let's recheck again before diagnosing or labeling people as hypertensives. So most important thing, there's this World Health Organization. So their motto is measure your blood pressure accurately, control it, so we live longer. So this is the motto of World Hypertension Day. Okay, now these are some of the cutoffs I have put for the blood pressure. There is quite a fair bit of variation between different countries, actually. So in Singapore, we follow the middle approach, which is slightly liberal approach, but they are newer. As research unwinds, they say the lower the blood pressure reading you can get, the more better it is, but provided the persons can actually tolerate it. So there's a caveat to it. So it has to be individualized. It is never fixed. But there are certain targets which you can achieve. As you can see, if less than 120, less than 80 is considered to be the best and the normal blood pressure. As long as it goes beyond that, people go into a pre-hypertension range until about 140, but after 140 is stage 1, and beyond 160 is stage 2 hypertension. Now, you don't need to have both the readings to be fulfilled to go into hypertension. One reading is enough. Like some people may have an isolated systolic hypertension. Some people may have an isolated diastolic hypertension. Okay, now just a side note, yes, white coat hypertension is, some persons' readings are elevated when they reach the hospital. At home, it's normal. And this actually doesn't need any treatment. The second entity, what we call as a masked hypertension, which means when you come to the facility, the readings are normal, but at home, your readings are elevated. Now, this has to be treated. Okay. Yeah. So why is this hypertension very important? So by 2010, this is a census from MOH and globally, hypertension has caused a lot of cardiovascular disease and millions of deaths worldwide. And 1 in 4 adult Singaporeans actually have hypertension. And this was from a 2010 survey by MOH, where you can see that, this is how its ethnicity is distributed in the population. The hypertension. And what we have seen is since 2004 to 2010, there are more people who are coming forward. The blood pressure control is becoming better. That's what we see from the curves. So it is mainly by better healthcare education, and people are more receptive to the information. Okay, now will it cause? How do you suspect? If let's say you have hypertension, how do you suspect that you have hypertension? Well, in the first place, it may not cause any symptoms, so it is very silent. So we call it as a silent killer, actually. So the only way you may know is if you check your blood pressure and you screen. And that's why there is an emphasis on screening. Because most of the time, symptoms can come when hypertension has actually caused some form of end organ damage. So then people may actually feel breathless, they can have a headache, they can have vision problems, and in the rare cases, they can even have nose bleeding. So these are some of the complications or symptoms which they may have with a very poorly controlled blood pressure. And so if let's say you are diagnosed to have high blood pressure, so some people may ask, okay, what is the cause for it? Why do I have it? Well, the cause most of the time is essential or primary, which means there is no underlying cause. It just happens due to the vascular tone or with age. So more than 95% of them is essential. Only 5% of the people may have some underlying secondary cause. Now, how do the doctors find out that it could be underlying or there could be an underlying cause? Is by review of examining you, taking your history, doing some basic blood tests, which may highlight a pointer to the doctors that, oh, well, probably this doesn't fit the norm. Then they will look and evaluate for other causes. Other causes could include, they could be varied, it could be hormonal causes, it could be related to kidneys or some medications, or it could be related to narrowing of the kidney arteries or the aorta, the main artery, or sometimes it could be related to sleep apnea, what we say snoring during sleep, less oxygenation in the sleep. Now, this is what typically happens when you are diagnosed with high blood pressure. So physician will see you, will get a history, will examine you, will do some basic tests like urine tests, some blood tests, and then subsequently will get your body mass index and height and weight, some basic parameters, and do an ECG. Then subsequently, they may look, they will advise you, they will educate you and counsel you on how to manage this hypertension. This includes diet, exercise, as well as medications. Now, medications, I didn't go into too much depth for this because it's very vast topic, and it is individualized based on the persons. And of course, if there is any abnormalities picked up, then there are more causes, more tests which the doctor will order to look at the secondary causes. Okay, now can I ignore my high blood pressure reading? Now this slide is the most important of all of the whole talk, I would say, because it is better not to ignore, because in the long run, the high blood pressure can give rise to stroke, it can affect the eye arteries, lead to retinopathy, and because of the constant high blood pressure, there's a shear stress, it will affect the arteries of the legs, what we say peripheral arterial disease. It can damage the kidney, it can damage the heart, give rise to heart attack, and also give rise to heart failure. So if you look at these two diagrams which I put at the right end, so this is the stroke risk as well as the risk of heart attack. So the bottom line depicts the diastolic blood pressure. So you can see that if the diastolic blood pressure jumps from 70 to 100, how incrementally the stroke risk as well as the risk of heart attack increases. And that is why we will need to control the high blood pressure. And if you treat the high blood pressure, even if you drop your diastolic blood pressure by about 6 millimeter of mercury, you can reduce the stroke by up to about 30% from the initial risk. You can reduce the coronary artery disease, which is the heart attack, by more than 14%. You can reduce this risk. And if, let's say, you reduce the blood pressure, the systolic blood pressure by at least 10 to 12 millimeter of mercury, so you can actually reduce mortality, which means 1 in 11 deaths in people who have no damage, organ damage to begin with. In people who even have existing damage, 1 in 9 deaths can be prevented. So, so this was the gist about the, what is blood pressure, what is high blood pressure, why do we need to treat it, because it will give rise to complications down the road, and what are the variations in the blood pressure and how it has to be recorded. We looked at these aspects. Now, let me just touch base on a few myths. So the first common myth people feel is, I feel well generally and I don't think I can get hypertension. So, well, as I said, hypertension is a silent disease. And most of the time, when people can have elevated blood pressure for long, long periods of time without having any symptoms. So the only way you can know is you do screening and you record the blood pressure. Recording blood pressure is quite simple, it's non-invasive, so I think this one should not be ignored. Now, the second thing is, my blood pressure is high. And I think it's because my heart arteries are blocked. That's why my blood pressure went high. So, well, this again is a myth. So there are two aspects of this we have to understand, because heart arteries blocked directly may not cause the blood pressure to go up. But on the other hand, a high blood pressure in the long run can cause the heart arteries to get blocked. So hypertension, most of the time, as what we saw, the cause is essential, which means there is no underlying secondary cause. So irrespective of, once you are diagnosed with high blood pressure, well, there can be additional tests which can be done to check on the heart health. But the most crucial thing is to target and treat the high blood pressure. Okay, the other myth, I have high blood pressure, but I don't think I need treatment as my body will be dependent on medications. Well, I would say that yes, if we can avoid medications and you can control high blood pressure by just dietary and lifestyle modifications, then it's excellent. But sometimes it is not always possible. In those instances, we may have to take medications. It is not called as a body's dependence. It is just that the body needs it. And, when we often say this, people also ask, is it going to be long-term or lifelong? I would say, well, there are instances in whom there are some patients in whom we start medications and down the road they modify their diet and lifestyle. The medications, of course, come down and can be taken off. It is still possible. So, but at the bottom line, we still have to control by all these measures, and if medications are needed, should be taken. Otherwise, we are causing damage to the end organs of the body. Now, the last one, clinic blood pressure readings are always reliable. Well, the recent research has shown that home readings are much more reliable than the clinic readings. Only caveat is that masked high blood pressure, which I mentioned to you, that the home readings are kind of higher, and but even then, a home monitoring is very much reliable compared to your clinic monitoring, because clinics, sometimes people are stressed, people are anxious, the readings tend to be high, and if people can monitor the readings and maintain a log and show it to the doctor, that's actually the wonderful way, because you don't go by one day or one point of reading, you actually look at the overall trend. And controlling blood pressure is actually looking at the overall trend of these readings distributed over a period of time rather than an isolated reading. And that's what helps people in achieving good cardiovascular health in the long term. Yeah, and that's about it. And thank you so much for patient listening. Yeah. Thank you.